medication. So, have we transgressed that fine line between the Hippocratic Oath and profits at all costs, even at the cost of death, even at the cost of death? So this question haunts me. This question haunts me. The focus on maximizing profits, even when it means pushing the unnecessary medications, it's a dangerous trend. It is a very dangerous trend, but nobody seems to know any better. They'll just chomp down. And you ever wondered why you're walking out with packets of medication when you visit a GP, a doctor in general? Did you realize that there's just more and more and more and more and more and more? So, one simple question I always ask in all of my my consults with my clients, especially when we're doing a healthcare application, for medical aids. And, one of the questions that I ask is, when you sit in a doctor's surgery, especially general practitioners, for most number of years, I just want to get your mind rolling, for most surgeries that I've been through in my entire existence, or from the time I can remember going to surgeries, they always had a sign in the waiting room notifying the medical reps, the pharmaceutical medical reps, the pharmaceutical companies send their salespeople out, their sales reps. And these guys obviously now are the link to the doctor's business side, and they then obviously tell the doctor, look, this is the new medication in the market, this is how it helps your clients, this is what it does, this is what it's for, blah, 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 blah. And so the cycle continues. But going back to that sign, the next time you sit there, look at it and think about me, when it says there, medical reps would only be seen between a certain time and a certain time. All right? That's their business side of it. So, guys, you've got to understand why we are being peddled with so much of medication. This is where the literacy, just wake up, wake up to what is happening around you. A lot of people say they sharp. Get sharper, because you still don't even know what is going on. So, because of the ignorance, that line between the Hippocratic Oath and the profits at all costs, it means pushing unnecessary medication, and it's a system where the well-being of the patients can be compromised for the sake of financial gain. Now again, I've experienced this, but because I was a financial consultant with one of the major, one of the largest medical aids in this country, in South Africa, I gained insights that most patients knew nothing about. And when I connected the dots for them, and this was part of me educating, teaching people, guy, why do you just sit down? I mean, are you paying for this? Is this a free service? No. So if you buy a loaf of bread and you realize that the bread is stale, you want to go back and change that, isn't it? Because you spent 18 Rand, but how many of you will even fucking do it when it comes to your doctors? Pardon the French. Sorry, tried to hold that back, but now and then expect one or two F-bombs in my show. I do apologize, and I'll try and edit that out, but yeah, so because I was a financial consultant, I had a lot more knowledge in terms of how the doctors worked. I looked at my statements and I held a lot of them to account because I immediately know where to go, what to look at, where my statements are, how much they were charging, and they were taken aback. But like, I mean, what are you talking about? A lot of times when I confronted doctors about their charges while lying in the hospital, the most famous response was, I don't know about that. I don't handle the billing. I got somebody else handling that. Maybe you should have a chat to them. Mother, I'm lying here. I'm asking you. You are my doctor and you charging me. You are charging me for those services. You are sending the bill to who you saw, right? So, guy, come on. Now, when I held them to account, then when you get backed into a corner, that is when I got accused of being an arrogant person and, proud and, the ego. And yeah, doctors were telling me this, but, truth be told, doctors, I've been dealing with you on a level, on a very personal level, for a long time, and maybe you're rubbed off. You ever think about it that way? Maybe you have rubbed off on me, and now you don't like it when somebody speaks the exact same way that you speak, treat people in the exact same manner that you treat. Hospital is not a butcher shop where you just walk in, look at that particular meat, speak to the blockman, tell them how to cut it, and walk away. No, man, we are patients, we have feelings, we're human beings. We're right in front of you. So, I've always heard this doctors say to me that, I worked and studied too long and hard, right? Worked too long and studied too hard. You always get this, for anybody else to come and tell me how to charge. I don't listen to this, but you call yourself a professional, right? This is what I'm trying to get to, is you always say that, we studied hard, and this is not an easy thing, and nobody said it is. God has gifted you with something, right, that many people don't know. The first thing about saving a life, staying calm, and you've been gifted, but a lot of you have forgotten the responsibility that you have. And that's the sad part. That's really, really, really sad. So, just bear in mind that some of these professionals, right, coming back to topic, they don't even greet you when they come there. So, man, how are you professional? I mean, the last guy, February, I had my 5th and 6th heart attacks. February 18th and February, a week and a half later. February 19th, I lost my brother. A lot of trauma. And when I was presented with this doctor after going through the emergency, and they stabilize you, do the bloods and blah, 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 blah. And then you get to ICU, and then here pictures this doctor. And I said to him, look, and I don't know him. It was an emergency. I don't generally use the hospital that I was in. And this all came along as part and parcel. And